After having a baby, menstruation can return at a different amount of time for different people. Most women will resume menstruation within 3 months of giving birth. However, if you are exclusively breastfeeding, you may not have a period at all during that time. My name is Dr. Mauney. I'm an OB-GYN at Houston Methodist Willowbrook Hospital. I've been here since 2018, and I'm currently the chair of the Department of OB-GYN and Pediatrics. Blood clots during your period are not normal if they're large or if they are excessive, meaning every single time you go to the restroom or need to change your pad or tampon, you're passing a clot. The best way to relieve period cramps are taking a medication called an NSAID or non-steroidal anti-inflammatory drug. These are medications such as ibuprofen, Advil, Motrin. Taking a prescription strength, which is 800 milligrams every 8 hours, is the best way to relieve those cramps and often works way better than Tylenol or Midol or anything like that. If the cramping is not better with the ibuprofen or Motrin or Advil, then I recommend reaching out to your doctor. Menstrual cups can be worn just like pads, tampons. It's really a personal preference. And yes, they're safe to use. They need to be removed and cleaned every day. Most people can wear them for maybe up to 12 hours, depending on how heavy your flow is. Period cravings are definitely real. They can come at any time throughout your menstrual cycle, and some women have them, some women don't. Unfortunately, there's not a whole lot we can do to help them. If you are craving something such as ice, which is also known as pica, P-I-C-A, that can be an underlying symptom or sign of anemia. So if you often crave ice, I recommend reaching out to your doctor. Period cravings happen because of hormonal fluctuations that are normal in a woman's menstrual cycle. Unfortunately, there's not a whole lot you can do about them. So it's just important to monitor what you're eating and live a little. Having a period versus implantation bleeding, it's usually about the timing of the bleeding and the amount of the bleeding. So if you're pregnant and you notice a little bit of spotting early on in your first trimester, that's likely implantation bleeding and overall usually very normal. Now, if your bleeding is heavy, like heavier than a period, you're saturating through more than one pad or so an hour, then it's important to reach out to your doctor. Having a late period could mean a lot of different things, and the differential diagnosis is extremely broad. So if your period comes more than a week late and you have a negative pregnancy test, I recommend reaching out to your doctor.